Hello, Mrs. Worsley.
That's right,
Hello,
yes.
Dr.
Yes.
McDonald, nice to meet
Oh,
you.
right, yes.
I've been given some information about you, so
Yes.
if I just check that's
Yes,
correct
of course.
before we start.
Yes, of course.
You're 48.
That's right, yes.
You work as a PA.
That's right, yeah.
And you've been having some abdominal pains.
I have indeed, yes,
Right.
yes,
Tell me
yes.
some more about that.
Well, these pains seem to come on in the morning, and, it all started actually after I went on a holiday to Thailand.
Right.
I had, diarrhea, the usual upset stomach, and I thought I just got, the stomach one usually gets, and I took Imodium and stuff while I was there, but it didn't really stop when I got back.
Right.
And it's been going on, for the past year, and sometimes the pain is quite severe. It's sort of cramping pains.
Right. Did you have any tests for infection, either while you were out there or when you came back?
I did have tests. I don't have an infection, apparently.
Right. So your GP's taken a stool sample?
Yeah, he has. Yes. Yes, he has. Yes.
Okay. And just tell me a bit more about the symptoms. You have, whereabouts is the pain? Is it?
Well, it's kind of low down, and it's usually connected with, going to the loo, moving my bowels,
Right. So after you open your bowels, does the pain go away?
It's much less, yes. Yes, it is. But before, it's, quite acute, yeah.
And how would you describe it? Is it a sort of burning pain, stabbing pain, cramping pain?
It's cramping pain, really, yeah.
Just a sort of squeezy...
Yes, and I just have to go.
Right.
Yeah.
So you also feel you need to rush off?
Yes, I do,
urgency.
yes, I do, yeah.
And is there any particular time of day this happens?
Well, it's mostly in the morning, actually, mostly in the morning, yeah.
So how many times would you have to go off to the loo in the morning?
Well, it could be as much as 3 times, I
Right.
sort of have a tea or a coffee and, maybe some fruit or something, and then I have to go, and then I come back and maybe have something else, and, I just have to rush off again. So it can be up to 3 times, yeah.
Have you had to get up in the middle of the night to open your bowels?
No, I haven't, no. Right. Seems to ease off towards the evening.
Right, okay. So throughout the day you might not go to the loo again, so it's mostly a quick succession in the morning, would you say? Or?
I would say so, yes,
Right.
yes.
And so although the pain tends to come back a bit, it goes away every time you open your bowels?
Yes, it does ease it, yeah.
Okay. And tell me about the stool itself. Is it normal in consistency or a bit looser, a bit more firm?
I'd say, it's a bit loose, actually.
Right.
I don't really like looking, but, it's
most people
it's kind of, I don't know, sticky or something, yeah.
Right.
It is loose, yeah, no doubt, yeah.
And when you say sticky, is there a lot of mucus in it?
Yeah, that's the word, yeah.
And any blood or anything like that?
Oh, no, I haven't noticed any blood, no.
And when you were out in Thailand, did you notice any blood then?
I didn't, no, I didn't, no.
And actually, to ask you a bit more about that, were you vomiting when you were in Thailand when you had this?
No, I wasn't, no, it was just
diarrhea.
sort of, yeah.
Okay. So, would you say it's got better at all since returning, or has it stayed much the same? Or
Well, no, I think, perhaps it's not as bad as it was. It was really pretty bad when I was there. But, like it was all day, I suppose. But since I've got back, I suppose it's slightly better, but it's not right.
And before this all started, were you someone who opened their bowels regularly?
Yes,
once a day,
I was,
right?
yeah. Never had any problems, no.
Any other symptoms at all any pain anywhere, heartburn, acid in the back of the throat, anything like that?
Not really, no. It's mainly just cramping pains, and I suppose I have to be careful what I eat.
Is it on any particular side lower down on the left or right?
No, I wouldn't say it was. No, I think it's mostly low down.
So you said you have to be careful what you eat, and I ignored you. What are the foods that you
Well, if I take spicy foods or even much alcohol, it kind of does give me kind of heartburn or indigestion or something,
Does it also mean you have to go off to the loo more frequently the next day?
Yes, it does, yes.
Have you tried excluding anything from your diet at all, or?
Well, I did actually go to one of these, allergy clinics.
Right.
And they gave me a list of things, like not to take that I was supposed to be allergic to, like dairy and, I don't know, certain types of nuts and
is this after a blood
tea
test
and coffee.
Or,
yeah, they did all their usual sort of tests, and I tried.
So wheat and dairy.
Right. All those kind of, practically everything. And I thought, oh, this is an awful, ridiculous. Well, I tried it for a few days. It didn't make any difference. So I've given it up, really.
I see. Have you lost any weight at all, do you think?
I don't think so, not particularly.
Clothes don't seem looser?
No, they don't. No, unfortunately, no.
Right.
Mm.
Tell me, have you had any problems with your bowels in the past or any other medical conditions?
No, I wouldn't say I have. No,
Right. Okay.
no.
And do you take any medications on a regular basis? Or?
Well, not really. I've taken Imodium and stuff, but
Right. Does that help at all? Does that?
Well, it did to begin with, and then it doesn't anymore. Really, you
Right.
know.
Okay.
And I've sucked Rennies and all sorts of things, but I don't really think any of it really helps. I'm still rushing to the loo, you know, with this diarrhoea.
Sure. Are you allergic to anything at all that you know?
Well, not that I know of, apart from these tests, you know.
Okay. And I mean, obviously, rushing off to the loo in the morning lots of times is not very convenient. And
No,
does that
it's
interfere
awful.
with your work as
Well,
a
usually
PA,
it happens
or?
before I go to work,
Right,
actually.
Yeah.
If I'm on location, which I sometimes am, then it is kind of a bit difficult to keep disappearing, you know.
Right.
It ends up with me perhaps not having breakfast or something like
Right, I
that,
see.
you know.
Do you smoke at all?
No, I don't.
Do you drink much? You said alcohol makes things worse. Do you drink much alcohol?
Not really, just maybe the odd glass, you know, but not anything. I don't drink regularly, you know.
Is there any family history of bowel problems?
No, there isn't.
Right. And just going back to your symptoms, have you noticed any change in your monthly cycle or anything exacerbating
Seems to
symptoms
get
with
worse, you know, during the time of my periods,
Right.
actually.
Okay.
But I thought that might be, I don't know, related to menopause or something.
that? Right. Are your periods becoming more
Well,
irregular or?
they
spaced out?
did lately, yeah.
And how are you otherwise? Any other symptoms in your chest, for example? Any difficulty breathing?
No,
any cough,
I
anything like
haven't
that?
found any difficulty there, no.
Any pains in your chest? Or
No.
any headaches or funny turns or anything else that's
Um,
bothering
no, I did have a sort of funny turn a few years ago because I was terribly depressed, and
Right.
my doctor put me on Prozac. That was before all this happened.
you? Right.
And I did have a funny turn, and I thought, oh, and he took me off it, and
see.
you know,
So you
thank
were on it just for a
goodness.
brief period where you go
Yeah.
3 weeks or so?
Yeah.
Right. Okay. So if I could just quickly summarise
Yeah,
back to you
sure.
what we
Yeah,
told me, let me
sure.
know if there's anything you think I've
Yeah,
missed.
yeah,
Your bowels were regular, once a day
Yeah.
person until about
Yeah.
a year ago,
Yeah.
and you went on holiday.
yes, to Thailand. Yeah,
Had an
sure.
upset tummy there,
Yeah.
with some diarrhea.
Yeah.
And since then, things just haven't settled down.
That's
You've been opening
right.
your bowels
Yes,
usually very frequently in the mornings.
yes.
And there's a lot of pain associated, which tends to go away after you open
Yes,
your bowels, but
yes.
then comes back, and it's a
Yeah.
cramping pain.
Yeah,
But no blood in your stool,
no,
and you've not lost any weight. as
not
well,
really.
so-
No.
And you've been told you might be allergic to wheat and dairy, but they don't
Yes.
seem to make a difference.
Well, it didn't make any difference when I gave it up.
I didn't really talk about your diet much. What do you?
Yeah.
You mentioned in the morning you have some fruit.
Yes, yes.
Do you drink much caffeine during the day? Do you think?
Well, I suppose I do actually. It's at work. There's usually
Right.
quite a lot of going, so I suppose I have about 6 or 7 cups of coffee a day.
Right, that's quite a lot.
Well, I don't know. Is it? I didn't think it
Has
was.
that changed?
but-
Have you always drunk quite a lot of caffeine? Or?
Well, perhaps since this, I went into this new job.
Right.
Where I'm rushing around and things, I tend to need a more caffeine stimulant, and that's why I couldn't give it up when they said I should, So I do tend to drink.
What would you normally have for lunch and for dinner?
Well, I sort of eat quite a lot of fruit,
Right.
and banana. I tend to like bananas and pears, but I do eat meat and stuff like that, and sometimes. I'm very keen on this new cereal that they keep advertising, apparently lots of fibre in it, so I might even have that sometimes as a dessert, which may sound crazy, but it is quite
Sounds like
good.
you have a very healthy diet. I mean, so you have fruit in the morning for breakfast?
Yes, plus a cereal, fibre
plus a
gel or
cereal.
something, yeah.
Lots of fruit at lunch as well. Do you, is this a new dietary change since your symptoms started, or is it
I
something
maybe have done more because I always thought fruit was so good for you and would
Right.
clear up all this, But I've always liked fruit.
Right.
But maybe I am having more. I mean, I make myself a smoothie, all that sort of thing, with fruit.
So you have fruit for breakfast,
Yeah.
smoothies throughout the day.
Yeah.
And
I know it
you mentioned
sounds-
bananas and pears. How many bananas
Yeah.
and pears do you think you get through in a day?
Well, I could put a couple into smoothies. Well, I could. Some days I might take as much as 3 bananas, 4
Right.
bananas. You know.
Okay.
Mm.
All right. Grand. So I think that covers most things, unless you think there's anything else that's important. And,
No, not really. Except I just hope something can be done about
sure.
it, and not
Well,
something.
we'll get on and start investigations right away.
Yes, if you would. Okay.
Right.
Thank you very much.
Thanks.
Thank you.
So this lady describes abdominal pain and a change in bowel habit, and really the examiners are testing the candidate's ability to instigate a series of logical investigations to explore this further. The most likely diagnosis is post-infectious irritable bowel. She's had a very clear sudden onset of symptoms during a holiday in a place where she's high risk of GI infections, and the symptoms have failed to settle down. They can often not settle down for up to a year after the index infection. She has some key symptoms that are suggestive of irritable bowel, in particular having pain that's relieved by defecation, and also going in quick succession in the morning if you have diarrhea predominant irritable bowel, and then not for the rest of the day. Also the fact that she doesn't need to get up and open her bowels at night and she has no blood in the stool would go against the diagnosis of inflammatory bowel disease. In terms of investigations, she's under 50, she has no alarm symptoms, no weight loss, no blood in the stool, so a colonoscopy would not necessarily be the next investigation of choice. She's mentioned she's had an allergy test, although food allergy tests are often dubious, especially at private clinics, and she may have an allergy to wheat, and she may even have celiac disease, so a celiac screen would be a good place to start. I'd also send off some inflammatory markers to make sure we're not missing an inflammatory pathology. And patients who are returning from a foreign country with diarrhea should have at least 3 stool samples sent for ovocysts and parasites. The real crux of this case is testing whether a candidate will take a dietary history during the course of the scenario, and this is often overlooked. And it's very clear in this case this woman's intake of caffeine is very high. She also has an extraordinarily high intake of soluble fibre, which is increased as her symptoms have developed. And that's probably contributing to her problem much more than it is helping to resolve it. Dietary histories are often overlooked by candidates and PACEs, and they're very important, especially if you have any abdominal symptoms or diarrhea, and especially if there's weight loss.